This is the lecture on scoring terminology used in assessment in special education. This is part 2, and we have left off with talking about basal, ceiling, and raw scores. And now what we want to talk about is transforming a raw score into scores that you will have on reports and scores that will actually have meaning when you pick up a report. And the first score we want to talk about is what is known as a standard score. And a standard score is a score that's been transformed to fit the normal curve, with a mean and a standard deviation that remains the same across ages. Now, what you're going to find is on most tests in special education, standard scores will have a mean of 100 and a standard deviation of 15. Again, a mean of 100 and a standard deviation of 15. And perhaps the most well-known version of the standard score with a mean of 100 and a standard deviation of 15 is the WISC, or the Wechsler Intelligence Scales, whether that's the Wechsler Intelligence Scale for children or the Wechsler Adult Intelligence Scale. Now, using this scoring system where the mean is 100 and the standard deviation is 15, a standard score of 115 would be one standard deviation above the mean. Think 100 plus 15 is 115, because the standard deviation is 15. Whereas a child with a standard score of 85 would be one standard deviation below the mean. Again, think in terms of if 100 is the mean and the standard deviation is 15, then a score one standard deviation below the mean would be 100 minus 15, which is 85. And again, if you think of the normal curve, go back to the lecture on the normal curve, the percentage of scores between a standard score of 85 and 115 would be 68%, because 34% would fall between 85 and 100, and 34% would fall between 100 and 115. Again, if this is unclear, go back to the lecture on bell curve and normal curve, and you'll see how this falls under the curve. Now, standard scores, also sometimes called scaled scores, will tell parents and administrators this what the child will receive on a given test and the appropriate classification that they will represent. Because when you see a standard score, or you see a scaled score, it tells us where the child falls within the appropriate classification. And let me give you some examples. Let's look at standard scores and classifications when the mean is 100 and the standard deviation is 15. Okay, so what do we have? Now again, what I'm going to show you here is just for one particular test. The manual will give you what you see here on the PowerPoint slide. This is not a standard. This is just what the scores mean for one particular test. So always look for the standard score and classification box within a manual to tell you what I'm about to show you. Okay, if a child were to get below 70 when the mean is 100 and the standard deviation is 15, in a sense, more than 2 standard deviations below the mean, we would call that classification on a particular test developmental delay. Anything from 70 to 79 is considered well below average. 80 to 89 is considered low average. 90 to 100 is considered average, with 100 right in the middle because the mean is 100. 110 to 119 is considered high average. 120 to 129 is considered superior. And 130 and higher is very superior. So again, for a particular test, in our example, the Wechsler scales, anything less than 70 is considered a developmental delay, and you can look through the chart that you see on your PowerPoints as to where you fall. So when you read a report, it will often say something like this. On the particular subtest, whatever that might be, so on the Wechsler scales of intelligence, Billy received an overall full-scale IQ of 105. This places Billy in the average range of intelligence when compared to the norms for his age group. If you were to read in a report, on the Wechsler Intelligence Scales for Children, 4th edition, Billy received a full-scale IQ score of 123. This places him in the superior range of intelligence when compared to the norms for his age group. So again, every test will tell you standard scores and what the classifications are. You always look for those standard scores, and then when you write a report, you talk about the standard score that the child received as well as the classification. Now, the other piece to this has to do with scaled scores when the mean is 10 and the standard deviation is 3. on many tests, we have subtests, tests within the test. So for example, on an IQ test, you might administer 10 different tests. On an academic achievement test, you might administer 7 or 8 subtests, like reading comprehension, math, spelling, and those are considered your subtests. Now on those subtests, they often have a mean of 10 and a standard deviation of 3. So when you do your scoring, the mean is actually 10 and the standard deviation is 3. And you can see on the PowerPoints here that when you have a standard score or a scaled score, it can be either or, where you have 1 to 3, that's considered a developmental delay, 4 to 5 is well below average, 6 to 7 is low average, 8 to 12 is average, 13 to 14 high average, 15 to 16 superior, and 17 to 19 very superior. So for example, suppose on a test where the subtest mean is 10 and the standard deviation is 3, we find that the child received a scaled score of 13. Let's suppose on an intelligence test on the block design section, the child received a scaled score of 13. We would say that on the block design subtest of the WISC, Billy received a scaled score of 13. This places Billy in the high average range when compared to the norms for his age group. Again, you will never have to figure out the scaled scores in terms of their meaning. You will just have to figure out what the child received as a scaled score. So when you score your testing, you will see situations where you'll have to calculate a scaled score or calculate a standard score. And all you do is go to the manual, all you do is look up what it is that the child scored, and you look at what the appropriate classification is that matches up to it. This ends part 2 of the lecture on scoring terminology. Again, from this lecture, you should understand what standard scores are and what scaled scores are, and again, when the mean is 100 and the standard deviation is 15, or when the mean is 10 and the standard deviation is 3. You can go now on to part 3 of the lecture on scoring terminology used in special education.